Note of the Minister's response to my question, which is, what is the government doing to retain doctors in our public hospitals? In her answer, she touted the Special Commission of Inquiry into Healthcare funding, which won't report until well into next year, while the worst awards in the country for doctors could be fixed now. She blamed the previous government for getting us into this mess with the public sector wage cap, and she's right. But how long will this Labor government continue to use that excuse for not paying health workers what they are worth now that they are in government? She touted the current negotiations underway through the Industrial Relations Commission. The Australian Salaried Medical Officers Federation, the Nurses and Midwives Association and the Health Services Union are there fighting for their members because the government's pay offer for the next 3 years is clearly unacceptable. A whopping 98% of ASMOF members voted against it. The government's pay offer for the next 3 years for medical interns, residents, registrars, career medical officers and medical superintendents, nurses and midwives, allied health professionals, medical imaging and radiation professionals, Aboriginal health workers, medical physicists, administrative staff, biomedical engineers, dentists, scientists, clinical and non-clinical technicians and professionals will perpetuate the exodus of our essential health workforce to other states. Retaining our current staff, not waiting for them to leave and then running new recruitment initiatives, is better for institutional knowledge, for collegiality, for morale, and for the budget. It's clear that the current awards for our essential health workforce are threatening the safety of workers and the patients that they care for. Matching or bettering the pay and conditions for health workers to at least on par with other states and territories was recommended by the Mental Health Inquiry and again just yesterday by the Legislative Assembly Committee looking at the implementation of the Rural Health Inquiry recommendations relating to workforce issues. But here's what our doctors have to say. I feel complicit in harming patients because of the inadequacy of the service we provide, despite me staying back late every day to try and improve this. Without more medical staff, our unit continues to crumble and suffer, and patients get much poorer outcomes. We've been told so many times to do more with less and work smarter. Our hospital delivers world-class care despite a broken, underfunded system by relying on the goodwill and flagging energy of our medical workforce that is being pushed to the brink. I have friends with mental health breakdown and burnout and even suicide in this system, and nothing changes. I remember what it feels like to be a junior doctor. In my first week as a new doctor, working as a surgical intern, I came home and I collapsed on the floor and cried every day. The government must act immediately to keep health workers in New South Wales. The Premier and Treasurer have repeated their mantra that we can't afford to pay health workers what they're worth, but we cannot afford not to.